consciousness by tuning into Contact Talk Radio.
And on TuneIn.com, Ping.fm, and UpSnap Mobile.
Contact Talk Radio.
Welcome to What the Health, an independent approach to your health span. Have you noticed how our healthcare system may not have your best interest in mind? Join Dr. Eckel in this fun and sometimes disturbing exploration of the state of healthcare and what it means for you. Now, here's your host, Dr. Eckel.
All right. Welcome back, everybody. This is Dr. Eckel, and this is What the Health. And I've got my esteemed colleague and great friend, Regan Archibald, on the show today. I really want to appreciate and say thanks, Regan, for showing up today with us.
My pleasure. Good to be here.
You know, I want to give you this smashing introduction. You are a rock star out there making change in healthcare as we know it today in America. So I will try to do this justice, right? He's founded some of the foremost cutting edge clinics in the country, if not the world, in integrative functional medicine care and regenerative medicine. He founded in 2004. East West Health, and he's got 4 clinics in the state of Utah, and use these clinics. I mean, I think I've known you for about a decade, and you have used these as a kind of clinician clinic to create healthcare at such an advanced level for folks that you created a whole nother entity called Go Wellness, which is training other providers on delivering this outstanding care. So, you know, Regan is considered an expert in the field of regenerative stem cell therapy, lectures extensively on that topic. He has 6 books, has created 15 healthcare programs, loves mentoring and coaching healthcare entrepreneurs, in addition to, you know, having a beautiful family and, you know, really being an inspiring leader out there in the field of regenerative medicine. He's got also Go Wellness Radio that he's interviewing and kind of putting forth this vision for the future of healthcare. And I just want to say thank you from the bottom of my heart for what you're doing out there, Regan. It's super inspiring, and you're impacting so many people on the planet. So there's my smashing introduction.
Wow. Well,
yeah.
That was impressive. I really appreciate that, Greg. I think if everyone can sign off now, and they'll be good. But the thing I love about you, Greg, is the innovation that you bring and the energy you bring to Go Wellness. Just the collaboration we've had has been phenomenal, because you bring such a unique voice and a unique insights, especially when it comes to brain health and rejuvenation. So thank you for creating this platform. What the health, man?
What the health? I know it really is there. And, you know, it really came out of my desire to really address head on what is happening in this country. And, you know, we see, you know, I was out lecturing this morning, and you know, you talk about this pharmaceutical cloud that we all live in, are inundated. And if you don't actually explicitly state it, you could miss it, because it's just so pervasive, right? And so persistent that we think it's a normal state of being. And while we look at, you know, healthcare spending in the United States being the most expensive healthcare on the planet, and our population being dead last, I'm wondering, maybe, you know, today's agenda, what I have on the agenda for us is I wanted to talk about the regenerative therapies. I wanted to talk about brain health and some innovation. I want to talk about some of the books, maybe most recent book for the general public that you've written.
Okay.
And then I also want to talk about the future of healthcare and, you know, what your vision is with this whole network of providers, which I'm so honored to be a part of, the Go Wellness affiliated network, and, you know, what's getting built there of some of the most heart-centered light beings that I know of out there that are really out, you know, advocating for people's wellness and creativity. And so, you know, if we start, where do we start? That's a huge agenda for our hour here.
Yeah.
Let's start with, what you're doing. Let's start with the locality. So with East West Health and what you're doing there, I know that's your testing ground for these therapeutics, and you've really designed a unique set of clinics where you've got it's truly integrative. I mean, you've got medical doctors and physician assistants and advanced practice nurses and acupuncturists, and
Mhm.
I mean, what are you doing there?
Well, I saw the problem, and I agree with you. It's like, man, we have more resources at our disposal in the United States than any other country. Like, the beauty of our free market system is we can actually practice this innovative medicine. Like, regenerative medicine in Canada is basically non-existent. You go down to Mexico, you go to Panama. Yeah, there's usually it's a healthcare entrepreneur from America who goes there and they set up clinics outside of the United States. Even in Europe, the practice of medicine is very heavily regulated. So we have this, it's kind of this juxtaposition where we have this opportunity to really break through in medical advancements and technologies. But as you said, the pharmaceutical companies and pharmaceutical industry has put a bit of a cap on what we can do because they've got the lion's share of the marketplace. So when I looked at East West, I said, well, what's missing in healthcare? Well, there's 3 T's that I always focus every patient who comes into my East West clinics. They get the right testing, and most people have to go to their doctor and beg for their doctor to run the labs. And you've seen this in your naturopathic clinic time in, time out. It's like, why didn't someone just check your thyroid levels? Like, I mean, all they're looking at is TSH, and it's pretty irrelevant. And so we say, let's get the right tests, and those tests need to be focused on the 5 pillars. So gut health, genetics, you look at hormones, we look at brain health, and then we look at detoxification. And if you can just kind of get testing based on those things, you can really lead a person into a better place of health. And then treatments need to be, that's the second T. And so treatments, that can be acupuncture, it can be ozone therapy, HBOT, you're using a lot of hyperbaric chamber. That's where we use stem cell therapy, regenerative medicine, PRP. And then the third thing is teaching. And those are the 3 T's. And having a mentor in your health journey is one of the most powerful things you can have, because think of a mentor in your life, Greg. I mean, can you think of a mentor you've had?
Totally.
Yeah.
Well, you're one of my mentors, mister.
Oh, you're one of my mentors. No way. But yeah. Well, let's talk about how we mentor each other, right?
Sure.
Like, you bring me, I'm freaked out about DMSO, and you're like, hey, look, I happen to know a little bit about DMSO, and I think you're exaggerating this, Regan. And so you accelerated my knowledge about what DMSO can do and what it, the reactions that I was afraid of. You just sped up my knowledge. I couldn't have found that on Google, by the way. So that's, you saved me years of having a false idea about something, and helped accelerate my ability to help people with DMSO.
Sure. Nice.
So that's, and I look at health, just to use that as an analogy, is in health, people don't understand what to do with all the information they've got. You see functional medicine practitioners, they run all the labs and then they hand it off to the patient, and the patient is worse off than when they started because they don't know how to execute.
Yeah.
And then they come to us and they bring in you've seen this with the folders of labs this thick, the suitcase full of supplements. And they're like, well, I'm on this for my MTHFR, I'm on this for my bacterial culture, and I'm on this for my cardiovascular function, and this is my liver detox. And now I'm fasting and not eating anything because I don't know what the hell to do. Right? So.
Yeah, totally. Right. Yeah. Like those practitioners in the functional medicine space that treat labs, right?
Yeah, exactly. Not the person. And so when I looked at East West, I said, well, we've got to have all those 3 components: the right test, the right treatments, and the right teaching. And then we need a multiple dimension mindset approach. So you need to have, Western doctors looking at it through their lens, Eastern doctors through their own lens, and then have a health coach that takes that information from both sides of the medical spectrum and helps the patient implement that in a practical way. So, in a nutshell, that's how we operate on every patient who comes in. That's our process.
Awesome. That is so lovely. And you're replicating that, right, in 4 clinics across Utah.
Yeah, we've helped over 80,000 patients have come through. And with our Go Wellness community, we've almost got 100 members in the Go Wellness community, and we're on a mission to end pain and chronic disease for 1 million people by 2025.
I love that. And I think 2 years ago, we sat down at the clinic dinner and it looked like we were on track for that, right?
Yeah, it's still, we're trending. We are gaining traction. I mean, I think by 2025, it's going to take some work the next 5 years to get the scalability where we want it, but we're right on track.
Love it. So on the biggest needle mover, would you say the biggest addition here has been in that regenerative medicine field? I mean, this is the one that, you really are, spearheading and educating and writing about, and also treating a ton of people with regenerative medicine. Now, I mean, you listed all of those other therapies as well, but I mean, in the 2 decades of practice that you've been in practice, have you seen anything else like this?
No, I mean, with regenerative medicine and stem cell therapy, I see that there, right now there's, it's kind of like this crazy free zone where people don't quite know how to put their finger on it.
Right.
I look at this as, we could get somebody to a certain level of health before we use stem cells. It may take us, 3 times longer, and we may not get the result that's as permanent. They'll need more maintenance care. What I found when we started implementing stem cell therapies, I said, holy cow, this is exponential growth as far as patient results go.
Yeah.
Because, exponential is something that grows at 10 times. So it's a magnitude of power. And we just saw that time and time again. I saw it in my own life. And then as I started using that with patients, I just said, this is crazy because I do less work. It ends up costing my patients less money in the long run, and they feel better and they get more permanent results. I said, this is something we've got to start writing about and sharing with people. And, of course, there's always going to be naysayers out there who are like, they are the regenerative medicine specialists, and anyone who comes in who doesn't have the specific credentials behind their name doesn't know what they're talking about. And, I just kind of, I LOL on that, laugh out loud because I'm like, hey, I've seen your patients, they've actually come to me because you didn't get the results. And
right.
We ended up taking them through the regenerative medicine. For me is no different than it's ever been. I still run the right tests. I still do the right treatments, and I'm still focused on lifestyle medicine with my patients. And that's what yields 50% of the long-term results.
Yeah, I couldn't agree more. I mean, we're seeing that all over the Portland market as well. And, when we come together at the Go Wellness gatherings, hearing what's happening in communities of people just injecting and being done and saying, that's it, it's like, oh, come on, we're so multifactorial as beings moving through time and space. We got to address all of it. And that whole program aspect of, we know what does a body good, and we just want to feed into it. So on, maybe just give a for instance of what you've seen, just some cases that have been like just blown your mind of like, wow, that too has been helped here.
Yeah, well, I guess I can speak freely about a few cases. I recently had one of my patients who's got ALS. He was diagnosed about 1.5 years ago, and his, you've seen ALS patients. I mean, His doctor gave him about 6 months, and he said, you won't be able to speak, you won't be able to walk. Your life as you know it will be over. And this guy, Warren, he's gone deep into stem cell therapy. He did stem cell therapy with us. He started with us, did amazing. And then he actually traveled all the way to China and used embryonic stem cells for his ALS.
Wow.
And so you can hear him on my podcast. That was my most recent episode, but he's still got his strength. It's 1.5 years. He's still ambitious. He's on a mission to find the cure for ALS. And he's got this whole Facebook group. And it started because he showed up at my clinic and he didn't know, like he said, hey, I don't know what to do about my ALS. I think acupuncture would be helpful. And I said, well, there's this whole nother level. And so we did intranasal stem cells, we've done IVs, and then we've injected him in some of the areas where he's having motor problems. And he's done phenomenal.
Oh, that's amazing. That one in particular is such a quick, debilitating condition. So just to even have something that has given some benefit, sounds like that's huge.
Yeah, crazy. Yeah, wild. Even if you saw Pain Revealed, I don't know how much of that docuseries you watched.
Yeah.
But the crazy thing about that is, the phone calls that I've taken from people who watched that documentary, they said, I love what your patient said. We had our patient who runs a big architecture firm. He's owned it for years. Chris is his name. And he was getting to the place where he put on 30 pounds. Both knees needed to be replaced. His doctor said, look, they're bone on bone. There's nothing you can do about it. Don't waste your money on stem cell therapy. And he was skeptical when he came, but he came and just sat down with us and said, all right, I'm going to give it a try. What do I have to lose? And when you see him on the documentary, he starts crying because he's like, yeah, I lost 30 pounds and that was really helpful. But the most important thing is I got my life back. And now I can see a future where I can stay active. I can be the person that I've always been. He's always been athletic. I mean, you look at him, he's got a really athletic build. I look at that and I say, man, health independence is my goal. I want to give people as much health independence as possible. Someone who has ALS, even giving them 5% more health independence changes them. Bone on the knees, we can say, hey, I think we can accelerate that to like 90% more health independence. That's
totally
right. Much simpler than ALS.
Yeah, way different ballpark, really.
Totally.
What do you do? So you get like the orthopedic community saying, well, it's bone on bone and there's no cartilage. There should be no cartilage able to grow again, right? And I know in your clinic and in our clinic, we're like, this is absurd. Like maybe in the textbooks, that's their thinking, but in reality of what happens in the clinic, we're seeing it change day in and day out.
Right.
Why do you think why is that the party line?
I think part of it is medicine is 25 years behind the research at least. Even though we're all packing around a smartphone that gives us the research, you just have to look and it's right there.
Yeah.
I mean, you and I used to have to go to the library. I remember that's where I would study.
Yeah.
And now it's like, I'm studying like right here. I can pull up whatever I need. But I just think it's just a lack of having the exposure.
Yeah.
And then the other thing that I see too is that the people who are making recommendations, and you missed it at the Go Wellness event, but we had an orthopedic surgeon who told me he's repenting from his past sins, and I'm not quoting.
Yeah.
And so he is incentivized to provide perform surgery and to do knee replacements, and so he's never seen anything in the literature that was ever convincing enough for him to see that let's replace this. But it's the verbiage that you use, like you've got a slip disc, is it possible to have a slip disc? Not at all. Your disc, it's not like your ankle bone does not go out. Your back doesn't go out. It's still in. I mean, it's just the language that we use. And then people think they're in greater danger than they are. Yeah. And then you've got the urgency that's created. Hey, there's no hope for you, Greg. It's bone on bone. The longer you're going, the more damage you're going to do to the bone structure. You need to get this thing operated on right away. Or with a slip disc, you've got this slip disc in your neck. Someone taps you like this, and you could be paralyzed. Right. And so, what's the general population supposed to do? So I think, and I'm not trying to throw orthopedic surgeons under the bus, but I have observed it enough where it's the language that we use. It creates a perceived danger that's not reality, because we see on average 2 millimeters of growth of cartilage. Now, people say 2 millimeters, that's not much, Regan. I say, absolutely, that's enough to create either painful knees to no pain. Like, that's huge.
That's huge. Yeah, that is an amazing change. And, I like to say we are living at an amazing time to have these therapies on board. There is some, I guess maybe just touch base on, there are some regulations or some, there's some things that are going to happen in 2020 with regards to regenerative stem cell therapies in the US. Now, it's a big unknown, but I'm wondering, in your crystal ball, what do you think? I mean, maybe if you were Kaiser, the king, maybe not the insurance company.
Oh God. Okay.
In the land of Regan, Archibald, and Go Wellness and East West Health, what I feel like these therapies are out. So many people are talking about them. I have patients, they're out to lunch. Somebody overhears them talking like, hey, I heard some stuff about stem cell therapies and I was thinking of getting that done. What do you think? And, these are two people, one had a procedure here, another had a procedure at another clinic. It's like, wow, this is really, people are voting with their actions and, lo and behold, are getting the changes. Seems like this ship has sailed, but, in a reactionary medical model that we do live in, I'm wondering what your thoughts are around that.
Here's what I've seen right now. The coolest thing that's coming up is, one of the coolest in healthcare is Haven. So Warren Buffett, Jeff Bezos, and the founder of JP Morgan Chase, they're creating a brand new healthcare model, and they just named Atul Gawande as their CEO, and he's a surgeon who's an outspoken critic of the United States healthcare system. He's the one that's talked about the complexity, and we need to take the complexity of medicine and simplify it. That's the only way we can get ourselves out of this, as Warren Buffett calls it, we've got a tapeworm in our economy, and it's called healthcare.
Yeah.
It's a $3.5 trillion industry. I mean, it's 20% of our GDP. Yeah. And I look at that and I say, okay, well, that's the big picture. But how it really in fact affects Americans is Americans are spending $14,000 per person on average for insurance. And that includes your premiums. And then you got a deductible, and your deductible on average is $6,000 to $8,000 that you got to smash through before you can even get access to your health coverage.
Yeah.
And then once you get into the doctor's office, now you got a copay, and maybe that doctor's out of network. And so you got to pay 40% more out of pocket. And so it's just a ridiculous model. And so I'm really happy to see some of the world's richest and most innovative individuals look at it and say, we could do it so much better. And they're actually doing something about it for their 1.2 million employees. So you asked me about the future of regenerative medicine, and not to take us off track, but I see what the FDA has done is they've said, look, by November of 2020, every person out there who is using regenerative medicine, they've got to comply. And this pertains to clinicians, but it also pertains to labs. And so one of the things that the clinics have already been shut down is those are the clinics who are making claims, and they make claims as if they've got a drug. And so one of the things that and I don't mean to get too technical, but the guidelines, the tissue reference guideline, it comes from your CFR 1271. And that tissue reference guideline very, very clearly spells out the difference between a 361 product and a 351 product.
Yeah.
And a 361 is what we've used for years, and I intend on continually using a 361 product, because this means it's a tissue that we use from healthy mothers, their umbilical cords, their placental tissue, their amnion membrane. And this is it's basically the biological material that allowed us to form in our mother's womb. We're using that same material to regenerate knees or calm down inflammation in the brain. And that substance, what the FDA says is you can't manipulate it. You can't put a growth agent in there and just grow out stem cells, because everyone, stem cells is the big buzzword, as we've seen. But the deeper I dive into the tissue, I said, man, there's TIMP2 proteins. Those proteins have robust evidence of regenerative capabilities, and the TIMP2 proteins are only found in the serum, and which, we use Utah Cord Bank, and there is some of the TIMP2 in the serum. Yeah. Then I look and I say, wow, MMP9 is another protein that's heavily found in the placental tissue, and that's a protein that breaks down scar tissue. And then you've got the young, hematopoietic stem cells that can remodulate the immune system. You've got MSCs that are very densely populated in the perivascular region of the umbilical cord. And that's what's just recruiting healing into the area. And so as long as we look at that and we say, man, all we're doing is recruiting healing, we're right in alignment with what the FDA wants. And I don't see that ever going out. That's going to stay in as long as we just stay compliant. And the FDA has already issued citations to different labs who are not following their protocol. And that's been, actually, in my opinion, that's been a really good thing. But it's the same if you're using bone marrow. A lot of the adipose clinics have been shut down because they have to do more than minimally manipulate that tissue, the adipose tissue, to extract the stem cells. There's an enzyme that they use, and that's been shown to be dangerous. I mean, people have gone blind by getting their eyes injected with it. And so this is, I think the landscape is great. The 351, if you do create a drug, now that's exciting because Huntsman Cancer Institute, which is right in my backyard, what they're doing is they're actually forming stem cells that can mobilize themselves onto cancerous cells.
Wow.
And then they shut down the signaling properties so that it starves out the cancer.
Yeah.
And we're going to see more and more of that. You look at Cellularity, who received a $250 million investor fund.
Sure.
And they have the T cell therapy from the placenta, and they're tackling cancer as well. And they're through phase 2 of the FDA clinical trials. Phase 3 is, and then they're in. So
wow.
The $450,000 treatment is what the 351 products are.
Wow. So that's what it costs to get that up and run.
That's what it costs to get it up and running, which is crazy, right?
Yeah. Wow. So that's awesome. That is not too technical at all. I definitely have clinicians watching the What the Health episode here. And so I think that's really important because there is a lot of confusion for the public and for providers. This component around using the full tissue, the whole tissue and all of the signaling properties, that is a piece that I lecture about extensively as well. It's not just a stem cell count. In the general population, that's kind of what the buzz terms are that they're tuned into. So there's an educational component for the general population and public, but also for clinicians as well, understanding like it is, it's the full complement of all of the signaling units in there, right?
Right. Yeah, totally.
And it's the body healing itself given the right information, right? So it's not these things coming in acting like a drug. We're not saying we're treating this specific thing. So that's awesome. So so I guess, right, good segue right into, we'll return into some nuances, into some specifics around brain health along those lines, because that's near and dear to me. On future of healthcare. So, looking at, overall, like, do you feel like, so this Haven group, they just named their system. How do you see, again, how would you improve on healthcare?
So I think the biggest thing I would do is a lot of people argue for a single payer, right?
You're right.
Why don't we just have Medicare for everybody? And I say, man, that is absolutely the worst thing we could do for our healthcare system, because then it thwarts any kind of creativity. You and I are innovators, and so we're always going to be pushing the envelope, and we're laying the railroad tracks for the future of medicine. And that's the beautiful thing about it. But when you have a single payer, then things start to get choked out, and innovation starts to get choked out because there's people who have their hands in the pot, like the pharmaceutical companies and the insurance industry and the big agricultural industry. They all are the same people sit on the chair. I mean, right. These are the boards of the big corporations, and they're all funding their campaign. They're funding the politician who's going to go in there and keep them in power. So I look at it and I say the best way is to innovate. Like, we've got health share programs, and that's really interesting because a lot of the way we look at healthcare is, well, how can people get access to it? And one of those ways is creating health share programs, more of those. Having not just insurance-based models, but also helping the public realize, like, hey, maybe we have a more innovative type of catastrophic insurance plan. And then when people invest in their health, have you noticed, Greg, how much better the results are when
Ugh.
a person they write out a check for their health and they say, look, I just invested $10,000 into my health, and I promise you they're going to get every penny out of that in return.
Totally. Oh yeah, that decision and that, really being invested in it. It's so interesting to see. You would think even the folks that you wouldn't think could quote unquote afford it, right? No, they are doubling, tripling down on their health because they realize, like, I use my body so much, I need this thing to work, right?
Right.
And so that I love that kind of that leveling up of themselves and, really investing in what matters, right? When you don't have your health,
It's all
you don't have
gone.
anything.
Yeah.
I've seen some really miserable millionaires out there. It's like, you can't take that stuff with you, folks,
Right.
So it is, I think, so that's great. So you would have, I think I'm in agreement around that, having kind of like car insurance. We don't think about using our car insurance to go get the oil changed or the tire, new tires or,
Yeah.
whatever those upgrades or the maintenance of the car. It's really the major accident that we need the insurance, and that may be the way. And also I think it would really put some incentive and fire under people to actually make the changes that they rationally know. But if they're having to pay for that, that would be very motivating. Like, I'm thinking about diabetes, maybe
Right.
obesity, some of these
Right.
things where it's like, wow, I got a lot more motivation because I want to take the trip with my family, right?
Yeah, totally. Well, and when we look at that, I say, exponential organizations.
Yeah.
So one of the things, if you look at what like Netflix has done, you look at what Uber's done, you look at what all these like great companies that are just like bringing us, like they're taking a resource that wasn't used. Like Uber is just like, people have time and they have a car that's sitting there, and I
Yeah.
happen to need a ride. And it's
Yeah.
like, oh, well, let me go pick up Reagan and he can pay me
Right.
to use my car and my time.
Yeah.
It's like a brilliant model. Netflix, what they look at is, with Netflix, you say, well, Netflix is a company and they create this like entertainment and this great content. And then Netflix started creating their own content and they pay their artists really well.
Yeah.
It's a resource where these artists, their work, it's hard to get into Hollywood. So Netflix said, fine, we'll just bypass Hollywood and we'll create a platform for you. And we got some great stuff that way, right?
Yeah, totally.
So I look at healthcare and I say, how can we innovate healthcare the same way Netflix has done it, the same way Uber's done it, even the same way Amazon's done it, where it's a delivery system that's very efficient and user friendly, but it's a system that actually gets the results. Because that's where I look at it. I say, with testing, everybody has a smartphone, they can get access to that. We have AI, people have this interface where the AI can help us understand the data. It can really track where a patient's going. Pretty soon we're going to have cyborg chips, and that will be amazing.
Yeah.
And so I just see the future is so exciting in healthcare.
Now, wait, a cyborg chip. What's going on there? You slipped that in there.
I actually slipped one in your arm last time I saw you.
You did. Awesome.
Yes,
Awesome.
so I can actually track your info right now.
I'm doing pretty well, right?
Yes.
I feel great. Yeah.
And so, and so the cyborg chip is, if you look at that, the cyborg chip is actually a way of tracking like where you're at up to speed. So it's a nano sensor that can measure, how your cholesterol levels are, what's your hormones looking like, what's your cortisol right now, what's your testosterone right now. And so cyborg chips will be huge in the future. Already, if you look at Abilify, the schizophrenic medication, Abilify has, the FDA approved this 2 years ago, where a patient will swallow a medication and there's a sensor on the medication, and that sensor will let up to 5 caretakers say, yes, he's taken his medication, or no, I'm going to go find Greg and hunt him down because he has not taken his medication.
Right. Well, and that's important, right? For that is it's a major issue, that diagnosis. And it's a novel approach. You can see, they actually have taken their med, right?
Right. Yeah. And I don't know that that's like, a big brother interfering with health. It's a little bit scary, but the reason I bring that up as just a point of reference is this is where we're going, where you can have instant access. And when you really create precision medicine, because that's what it's about. That's why we say everyone needs the right test, because I want to be precise, because what your needs are going to be different than mine, and they're going to be different from Warren's or from Bill's or from Sarah's or whoever is coming in, right? But in the current model, what we've done is we've said, well, we're going to run the same standard panel on everybody. And then we're only going to give them a diagnosis if they have a disease that shows up. And so then we're playing like catch up the whole time. And so it's like, uh-oh, Greg, your cholesterol's high. What's going on? And then we give you the wrong advice, like no more fats.
Right.
And you got to go on like, you want to take out anything that it's going to be tasty in your diet. And then that should help, and let's get you on a statin while you're at it, and your muscles might ache and your brain fog may be so severe that you can't remember your kids' names, but otherwise you'll be fine.
Right. Your cholesterol will go down, and now you've got dementia and all the host of other things. We definitely know that the system is broke. I mean, it's a good cue into announcing, if you're just tuning in now, this is What the Health. I'm Dr. Greg Eckel, and I've got my guest today, Regan Archibald, a leading expert in regenerative medicine field and functional medicine. Super amazing innovator here. And we've got, howdy. And we've got you live on the air. So so welcome. And if you're just tuning in, check out naturecuresclinic.com. I've got the episodes on live stream there. It's under the podcast link. And finding out information about Regan and his clinics and this whole new future of healthcare, I've got that in the show notes as well. So welcome aboard, everybody. So getting back into this, that is really the future of medicine, right? If it's not measurable, you can't really track it, you can't change it. And then you're coming at it from this background, right? You've got this training in one of the oldest medical systems on the planet, right?
Right.
I'm curious for what was the switch for you where like you were like, okay, this is awesome. I'm helping you. I mean, you had some of the largest clinics in the United States, right? You're saying 80,000 people helped. I mean, you've got a huge wealth of clinical experience, and you're a clinician's clinician. I like to say, what works clinically in the real world.
Yep.
Because of that, because of the practices that you've developed and all of the support that you're giving other people to have large, impactful practices. What was the switch? Was there a specific moment or a patient that came in and you said, we need to do more here?
I think the biggest thing, and this is what I love about you, Greg, is you listen to your patients, and then what your patients have needed over the years, you've innovated in a way that most doctors won't. Instead of just staying in your little naturopathic bubble, you've said, no, there's better ways I can help these people. And so you've sought out mentors and you've done the research. That's all it was for me too, is just like, hey, I want to see what I just keep hearing themes. I have patients who they're like, I don't want to get surgery. I'm like, okay, why don't you want to get surgery? And then they tell me, well, I'm afraid I'm going to get a blood clot, or I don't want to get an infection, or my sister had the surgery, it didn't work for me. Or I have patients over the years, I don't want to do the medications. And I say, why don't you want to do the medications? And so I think the biggest light bulb that went off for me is when I had my first doctor reach out to me. Her name was Pam Vincent, and she was a neurologist. And I hadn't been practicing more than 6 months. And she had a couple of her patients came to me for their headaches. And then another patient came for MS. And she said, I don't know what you've done to these people, but they think you're just like some kind of savior. And she said, I at least wanted to get to know you. She said, I don't know anything about acupuncture. I don't know about Chinese medicine. And we just created a relationship. And she's ended up saying, hey, can you teach me how to do some acupuncture? Because I was very limited in my time. My practice was so busy. And so I would go work at her clinic one day a week. And so I started training her on acupuncture. She did the Stanford program for physicians. Wow. And she said, I still don't know anything, Regan. So like she almost felt worse after she tried to learn it to see how complex the medicine was. But she was really the collaborator with me. And I worked with her for 7 years. And then I ended up hiring her daughter out of med school. And her daughter was my first physician that I hired at East West.
Oh, wow.
And so that was arguably my first exposure of seeing how powerful the medicines could be when we just collaborated and worked together. Because Pam Vincent, she kicked out all the drug reps. There went my free lunch.
Yeah.
But
yes.
They were booted out because she just started to see this cycle. She's like, I've been educated by drug pushers my entire career. Mm-hmm. And she said, you bring in this old medicine, and this old medicine works way better than my new medicine. Not that, she didn't get all her patients off medicine carte blanche.
Right.
She was strategic about it, but just by seeing the amount of change that I created in her practice by blending the medicines, I said, this is how healthcare needs to be.
Love it. Love it. All right. So let's change gears. I want to talk about your most recent book for the general public. Mm-hmm. And what motivated that? Because I think it's right in here, right in line with where we're talking about.
Because my newest book is called Your Healthy Self. And if you do a little wordplay with that, healthy self is heal thyself, right?
Nice.
And so I put your on there because I want people to just take it more personal, because healing yourself is, at the end of the day, it's all about you taking that first step and really committing to your health. Because the commitment, once you make a commitment, it's either 100% or you're not there. There's no such thing as a 99% commitment, right?
Right.
Like you and I are having this discussion, and there's 100% commitment on both of our parts. If it was 99%, then I'd be like, well, I'm still going to think about getting on this call or the radio show. What the hell, And
yeah.
So that's what Your Healthy Self is all about. It's about just make the commitment and try to imagine yourself getting 1% healthier every day. That's it. It doesn't need to be big. It's the small things that yield huge results. I mean, if you think about what are some of the worst short-term decisions people make in their health, Greg, what would you say they are?
Oh, smoking.
Yeah, smoking. It's like the short term is like, oh, I feel this like rush of adrenaline from the nicotine, right?
Right.
What's another short term that's?
Another definitely having the cookie and the cake after every meal, right? Every meal.
But I like cookies and cake, but what happens in the long run?
Right. In the long run, that is diabetes happening, right?
Yeah, totally.
We got another one on, I'm just going to binge Netflix rather than moving my body.
Yeah, exactly. Yeah. Speaking of Netflix.
Yes, right. Thank you, Netflix.
Really easy to binge.
Yeah.
And you can just consume and consume and consume, and you're not giving to your own body first and then to the world. And so that's all Your Healthy Self is about, is looking at that and saying, hey, instead of turning on Netflix, why don't you just get out of your chair and go exercise first? Don't skip a day of exercise. That's what, one of the things. Exercise increases brain-derived nootropic factors. And you actually did a lecture at Go Wellness about a 5-minute sprint.
Yes.
Is the best ways to increase BDNF.
Yeah.
And, so I'm just encouraging people to look at the short-term things that you're doing and think in the long run, what are the consequences of that? Because what are you going to feel better if you and I went on a bike ride, or if we sat down and binged on Netflix, right?
Yeah.
You and I are going to forget whatever that was we watched. Maybe we'll remember a few little things about it, but we'll remember that bike ride, and we're going to feel a lot better when we get back from that bike ride.
Totally. So. Yeah. And creating that memory and just the body cellular memory of the movement together and the experience, it is, so the whole it's your healthy self, right? Yes. Your Heal thyself. I love that.
Yeah.
So you have a stepwise program in there for folks to kind of get this 1% increment, or is it more on the mindset?
It's a lot more on the mindset.
Yeah.
There are some step-by-step criteria, but the cover, it says, optimizing health, brain cells to stem cells.
Awesome.
And so, I start out the book and I say, how old do you want to live to be? Because a lot of people, they don't put a number down and they forget, like, hey, we don't know when this thing could end, but I would much rather die healthy than live the last 10 years of my life really sick. And so I just paint the picture. The oldest person on record is Jeanne Clement out of France. And she lived to be like 117, 118. And we have her baptismal records and her death certificate. So it's like she's this like crazy novelty. But now we're seeing more super centenarians. And we're like, so I just said, how old do you want to live to be? And you can't do that if you don't have good stem cell health. And so the older we get, we start losing stem cell populations. Our stem cell population declines. And not only does the population decline, but the stem cells that we have left, their ability to replicate and duplicate and, become therapeutic is minimized as well. And so, patients ask me all the time, why aren't you using my bone marrow stem cells? I'm like, well, if you look at the research, there's ways of amping those up, but it's still risky. That's why we want to use young stem cells. It's the same reason why we heal faster when we're younger than when we're older. But I draw out some ways of increasing stem cells, like time restricted eating, fasting, or things you can do on your own, staying active, exercising. And then stem cells are very sensitive to vibrations and the energy you put into them. Not to get too woo-woo on you, but I know
we can go there. We do that on this show.
Go there.
Yeah.
But there's studies out of Harvard where vibrations actually limit the amount of stem cell proliferation that they can have. Just that the environment that you place stem cells in, and Bruce Lipton, who I'm sure you know, Lipton, he was one of the first stem cell researchers 30 years ago. He said, it's the environment that you put the stem cells in, that's what creates the lineage and the expression that stem cell takes on.
Yeah.
And so what's the environment in your body? And that's what your healthy self is about. And then really about anti-aging and living a long, healthy life until the very end, where you have this compressed morbidity, where you just die fast. You don't drag on the last 10 years of your life.
Yeah.
That's what I'm shooting for. And that's what the book is about. And so keeping your brain healthy is critical in that whole process.
Love it. Yeah. So great segue. So we'll finish strong here with our last 13 into brain health, right? Because that is, we're seeing rates of dementia, Alzheimer's over 65. It's like 50% of people now are predicted. And then the stats get worse as you get older.
Yeah.
I was flying yesterday and sat next to a 90-year-old, and she said, boy, you're a brain regenerative specialist. Like, I need you. Like, my whole community, like, she's 90. So like more than half of her friends have lost their minds. She's like, I go in and I visit them on a weekly basis, but they don't really remember. They got the old memories, but there's nothing new. Right. So, wow. When you say, you want to live to be 150 years old in public venues, you can like hear a pin drop. People look at you like, are you crazy? It's like, no, we actually can do it with our brains and our brawn and community, right? So, so brain health, right? You guys, you had our quarterly gathering down there at Go Wellness, this awesome network of providers that are, really cutting edge therapeutics, and we all get together. What I love about the group, and I'm going to just share with the listeners, it's a broad array of providers, and there's really no ego. It's just about how many people can we help? Can we help more? And can we help them faster? With that being the full mission of Go Wellness, like what a unique, vibrant community you created. Like, you hear colleagues are just griping about healthcare system, and, we get together down there. It's like getting the soul recharge of the battery of like, yes, we're out kicking ass, So on brain health in particular, right? Because we can do it with our brawn, but if we don't have the mind, what are you seeing in that realm? Like the biggest levers that one can push on for brain health?
Well, I think that's there's kind of a multifaceted approach, but I'm into things that can get into the brain easily without needing to be transported all over the body, and so intranasal stem cell delivery has been really exciting.
Yeah.
And using intranasal stem cells with peptides, either like cerebral lysin or Cmax, even treating conditions like Lyme, because the brain, if you have infections in the brain, it's really tough to have a brain that functions properly. And so even using like synapsin has been actually really exciting, or LL37. Those are exciting peptides that I've seen used for the brain.
Awesome.
I'm a big fan of nootropics, and
yes.
really excited every time I get my hands on a new nootropic. And so that's something I'm excited to, I feel like that's a big breakthrough. But with the brain, probably in the last 2 years, just the acceleration of what we can do with the brain, with traumatic brain injuries, with our patients who have early onset dementia or Alzheimer's, if we can catch it on time, it's been really exciting. Parkinson's, MS, ALS, those things are really exciting. And you've got some brain rejuvenation. I mean, you're like the leader in this field.
I've got my fancy approach. That is true. Yeah. And, educating folks, I always glean some great information, and, we want to know what works clinically. So yeah, I've got a whole episode on that. If folks are just tuning in now, you can kind of binge listen to What the Health here. But, on that component, you're doing some stuff with low doses of insulin. Is that right?
Yes.
And you guys can get that over the counter in Utah, is that right?
Well, I can either have my pharmacist make it for you, and it's a intranasal insulin, so it doesn't impact blood sugar. Okay. That's where people get this misnomer, but it's really hard to get insulin into the brain. But insulin is what actually carries the stem cells and creates new neural pathways. Great nootropic. So I can have my pharmacist compound it. It's around $160, or you can go get it at CVS or Walmart over the counter, Novolin R, and it's $20, and you put it in a nasal mister. So It's a no-brainer. It's very simple, and it's a powerful therapy. I mean, it's something that we get every single person who does intranasal stem cells. We say, yeah, you need to get on the nasal mist with insulin.
Yeah, that's awesome. That is so awesome. What are your other favorite nootropics right now?
So I love aniracetam. Aniracetam is really it's an amazing formulation for motor skills. So if I'm riding my mountain bike, I make sure to take some aniracetam. It does stimulate some GABA, so you feel more connected on aniracetam. But cool. Then it loads the prefrontal cortex with dopamine, so you can focus really well, but it's more of a creative type of focus. And I use that with acetylcholine. So anytime you're using a racetam, then the acetylcholine is what actually helps you lay down the acetylcholine pathways for better long-term memory.
Oh, love it.
So yeah, I like that. I like NoPep.
NoPep? What's the NoPep?
NoPep is it was named Nootropic of the Year in 2017.
Wow!
And for the Emmys, it was all over the news.
Awesome. Yeah.
But NoPep is just it's just another it works on the cholinergic receptors and helps with dopamine production. It's also great for creativity, memory, short-term and long-term.
Lovely.
It's sharp. It's just clean energy.
Love it. So we're down to the last 2 minutes. So I like to ask folks, what do you do? What are the biggest movers for your health, your routine? How does Regan stay at the top of his game day in and day out?
The biggest thing, no matter all these like cool hacks that we talk about, I think just relationships and connecting with people. Mm-hmm. I mean, you're a close friend, and I really value and admire you. And just loving people is probably, I know it
Yeah.
sounds super cheesy,
No.
but I thought about this weekend after Go Wellness, after being with so many cool people. And, you know, I miss my family during the weekends,
Yeah.
but I have so many other relationships that nurture me. And
Yeah.
then I go back to my family and I'm like, man, I love my wife. She's just phenomenal. My kids are amazing. I just feel super blessed with relationships. And so
Love it.
that's it.
I love it. That is not cheesy at all. That is so on brand and target. Like that is, I mean, I think, you know, we all can agree we want to live in that abundant, loving world, right? And so the more we can talk about it and put it out on the airways, you know, it's just a good encouragement for folks listening. You know, make sure those in your closest surroundings, or if you're thinking about somebody, just call them up, tell them you love them. Like that, if we're all doing that, like that's what it's going to come back around. And, you know, thank you for sharing that. Like that is actually an important message. We can get lost into some of those details and they're super fun. We can totally geek out on a provider level. We can share it with the public on a level to be consumed as well. And sharing that knowledge is super important. And in essence, you know, we are heart-centered beings, and that, you know, in a Chinese medicine fashion, the emperor empress really rules the roost. And lo and behold, that's the way it works.
Yep. Awesome.
Anything that you would like to share in our final closing minute with the listeners of What the Health?
No, I think that's just the biggest thing. Like,
Love it.
you know, put your relationships with yourself first, and then relationships with others. And then you'll have this relationship where your health will become 10 times more important to you, because that allows you to express that love.
Yeah. It gives that reason. So thank you for those great closing remarks. Appreciate you so much coming on the show. Again, everybody, this is What the Health. We're on Tuesdays, 2 to 3 Pacific Coast time. Please share this with your loved ones and your friends and family. This is where we're bringing you the truth of how to stay well and thrive. So thanks for tuning in.